How does the body react to a stab wound? Damaged cells release histamine, which diffuses into nearby blood capillaries, causing them to dilate and become leaky. Phagocytes are attracted to the injury site, and they move into the infected tissue along with blood plasma. The plasma causes the swelling we associate with infection, and the phagocytes engulf bacteria and dead cells. As the histamine disappears, no more phagocytes are attracted, and the tissue gradually returns to normal. The symptoms of inflammation are swelling, pain, redness, and an increased temperature.